share my screen, and then Danny, you and I can take turns. I'll let you know when we'll switch over to more of the transplant center specific processes. Um, so there we go. Okay. So the overarching idea around goal deployment, our purpose and sort of is to make sure that every year we're able to produce team goals in fairly quick fashion. Identify what clarity is needed for teams so they can be certain about what is expected of them, how they can meet these goals, and so forth. A couple other pieces tied to this are flexibility, not even just around assigning the goals, identifying the goals to begin with, but also throughout the year, if we're identifying that maybe the target isn't quite right, it needs to be enhanced or better aligned with what we're actually seeing on the ground for that year, then we can make those changes. As well as identifying key areas where we want to kind of focus our impact. So we're not trying to I don't know if folks have seen like the radar diagram where you're trying to reach all of the 5 points. Well, sometimes we need to focus on just a handful. So, and then making sure that the goals are meaningful for the team and aligned with from individual contributors, what their daily actions are, to the goals of the team, the goals of the department, all the way through the goals of the hospital system itself. And just really creating this seamless integration between, again, that daily work and our annual goal for our department. And then also ensuring that our leadership is engaging with our teams. And so that there's some buy-in from both sides where leadership is identifying that these are solid goals that we can work towards, and the teams are identifying that they make sense and they fit with the work that we're doing day in and day out. So kind of the broad strokes of this. It is a more or less 5-step process. The first step is just identifying what are the goals of the institution. Historically, that has meant waiting for what the granular targets and metrics and so forth. But really what we're trying to do is identify what are the underlying themes? What are the ethos behind the different pillars or domains for alignment goals? So quality, access, service, culture, and efficiency. What is it that we're trying to do as we're identifying metrics to work towards? And then, going from there, operationalizing these elements through cascading. So leaders will kind of discuss at their level what makes sense, what can they do. They'll collaborate with their teams and see what makes sense at next level of supervisors closer to the work. And then ultimately when you arrive at the individual contributors, then aligning through engagement, making sure that you're having these robust conversations, and setting these goals in a way that's meaningful, not just from an operational perspective, from the management's perspective, but also it's an open dialogue. So team members are able to contribute to this, and really working towards this sort of SMART goal model that we'll talk about later. And one of the elements where DES comes in is for this visual management system. Making sure that the progress towards the goals is visible, team members can identify, when we're meeting it, when we're exceeding it, when there are opportunities for us to kind of dig a little deeper into what are the opportunities to kind of close those gaps that we might be seeing, as well as sharing our progress as we sustain these metrics, celebrate different goalposts that we reach, and really discuss any obstacles that are coming up. And on the right hand side, you can kind of see this timeline of sorts. the first three elements really should kind of, in a perfect world, occur between March and June as we're kind of having these initial discussions. And then, July and onward, we're implementing the goals, we're deciding how they are best visualized either on our DES boards or whichever platform teams are using. So we're using this slide here to kind of underscore the health system's overarching goals. So, culture as our bedrock, making sure everyone feels cared for and belonged. So what kinds of goals can be set that kind of fit within this scope? When we're talking about efficiency, the health system is focused on ensuring that we have a strong financial foundation. So what ways can we work within kind of the ethos of designing and investing for financial sustainability that makes sense locally for our team? That could be, something as simple as, I say simple, but it's more complex than initially perhaps perceived, is taking a look at pick ideas or idea boards if you're using the physical space. And, just really looking for process improvement opportunities for your team to build efficiencies, to reduce overwork, rework, waste in the system kind of thing. Operational clinical excellence, these are things where we're talking about improving access, we're improving patient experience, really working to achieve our high reliability. What goals can we kind of create in this space that makes sense for our teams as well? And then, using all of these, what goals, I guess the core of this should be what goals make sense for your team within these different elements and that align with the domains that we're focusing on. So this is one of the documents that we kind of started with the goal deployment team. And so you can see on the left-hand column, we have the organizational goal. These are the domains and kind of like those overarching goals that we have. So with regard to quality, achieving and sustaining high reliability, the service, so delivering excellent experiences for our patients as well as staff, access, improving and accessible comprehensive care, culture, making sure everyone feels cared for and belongs, and efficiency, again, that piece is around designing and investing in opportunities to develop operational sustainability. And so again, those are the ethos, and they should really kind of inform the objectives that you're constructing and the key results. So those two pieces together kind of form the metrics that you're following. This one also has more of like the check-ins with leadership. So it has like the where are you at different checkpoints for each quarter. And you can kind of identify with those leadership check-ins if you're on track or not. We obviously have capacity to include a variety of key results, different metrics, and so forth. But usually, one or two metrics per domain is usually sufficient for teams. And then one of the things we'll notice is as we're constructing things that make sense for our team, it'll be somewhat, maybe a little bit tangentially related to the next level of management above us. So department level, site level management might be focusing on, this example, reducing costs through surgical case waste reduction and operation efficiency activity. The next group above might be focusing on maybe a larger bucket of operational costs within surgical areas. So there's sort of a relation there. And then when we get up to, say the tier 3 level, Jen and O'Leary, it might be just a general operational cost reduction. And this is just purely focusing on the efficiency bucket, but other domains could have very significantly different goals. And couple of the arrows on here, just making sure that we don't necessarily have to have the same goal or even directly align, but it would be nice for our goals to kind of feed in to some extent, even if it's not like directly, you're doing a portion of the next tier's goal. You're working towards something that benefits ultimately the work that's being done and tracked in those other components. We'll talk about how that looked like in our transplant implementation shortly. And ultimately, what this looks like is the entire 14,000 employees at UCSD taking action according to a more unified plan, even if we might be looking at different elements in different parts. And so we have all of our documentation material, assistance for goal deployment available on the Transformational Healthcare website. See what we have there. And then you can see our handy dandy goals metric, as well as the different steps delineated below. And each of those have relevant tip sheets that can kind of guide what elements of the process you're going to be working towards as it makes sense for your team. Danny, I don't know if you want to walk us through this kind of early timeline.
Sure, happy to. Thanks, Josh. As you guys can tell, I'm super lucky to have Josh on my team and get to work with him on a day-to-day basis. It's been such a pleasure. So my name is Danny Ramstock. Thanks for letting me come and join your meeting. I am our kidney transplant and living donation manager here at UC San Diego. And I had a goal expert. So this year we tried to embrace this process. I thought the masterclass was really great. So if people didn't get to see that, I definitely recommend that for folks to watch, and definitely as they're having questions about this process. So we tried to start in kind of April, May to have conversations about our potential goals for the following fiscal year. We were looking at fiscal year 25-26 that we're in now. And in late May and early June, we were trying to get clarification from that tier 3 level of what we're going to be our institutional goals and what were those going to look like for tier 3. I think this kind of June timeframe is where we kind of got a little bit tripped up and worried that we didn't have those tier 3 goals exactly defined. And so some of our team members were like, well, how are we supposed to decide at the tier 2 level and then subsequently at the tier 1 level, what were our goals and how are we going to review those? Like, how do we decide what we're working on if tier 3 hasn't decided what they're working on? And I think this is where we learned a lot, and I think really had some good discussions, which Josh helped us to kind of lead to say, look, we know what our institutional pillars are, right? What our overall goals are going to be. Those don't necessarily change year to year. So we've got patient safety. We want to be, financially sustainable, all of those different kind of overarching goals, those domains, if you will, that UCSD focuses on every year. And so even though maybe we don't have those tier 3 exact goals, we can still kind of take those overarching guidelines and bring them down to our front level and just say, okay, well, we know that we're not always doing the exact same goal that tier 3 is doing because we need to make it more day-to-day frontline friendly. And then we need to make it tier 2 applicable to our specific department. And so I think as we had those discussions, it felt a lot more freeing. And so I think having kind of level setting that up front to just say like, hey, we're going to start these conversations, even if we don't have, tier 3 hasn't told us their exact goals, I think was a good learning experience for us. So as we started to try to draft our tier 2 goals in June in preparation to be able to then take it down to tier 1, we talked a lot about what were we looking to do and how to tie that to those overall objectives. And then once we got to not even finalized goals, but kind of overall, like these are the things we think we want to work through. These are our objectives. Then we took in, July, we got to the point, we tried to start it in June, but it was, I think, July before we finally like took it to the frontline staff and said, hey, and this is where I took it to my teams and said, hey, this is the overarching kind of direction we want to go. We really want you guys to be a part of this process this year, because the whole point of our DES huddle is to make this information meaningful, to be talking about things that you guys can actionably do on a day-to-day basis, and how that cascades up to the higher tiers. So we took our thank you. We took this kind of goal deployment worksheet, if you will, and Josh and I had met, and I kind of outlined some different objectives of potential things that I thought, as a manager, these are things we've been tracking. These are things that I know will cascade up, and said, hey, here are some potential ideas. This is where we really started to put in those key results and say, okay, we could potentially track achievement and want 100% of this regulatory compliance that we have to do. That's been something that we ongoing kind of struggle with and have to reconnect to frequently. We do audits for it. And in the data source column, which is really helpful as you're trying to decide your goals, I think Josh helped us to tie that to, okay, well, what's your data source for that? Because if you're making these goals that then are going to be really hard to track, it's things that you don't already have data for, it just makes actual deployment a lot harder. So I think talking about it up front and just lining those two up helped us to kind of narrow things down. I think also helped Josh and I as we presented this to the team, and we said, hey, we're going to talk about goals. Here's some ideas. And then we want to bring the group together. And so I brought my team together, and we did it kind of an extension. One of our DES huddles, I, extended to 30 minutes and said, we're going to talk about this. We'll do our quick huddle, and then we'll really focus on goals. And so we said, what are you guys' ideas? Bring them. And we got pretty good participation. I think as we started talking about it, I would say, hey, here's kind of what I thought. Is this meaningful for you guys on a day-to-day basis? And we had folks kind of put out and say, well, gosh, like everybody's talking about access and this like schedule utilization, but we don't know what that means. And like, we don't understand the numbers. And to me, I was like, my frontline team does not want to know like these like, management terms of like how exactly I'm tracking arrived and booked and all that stuff. But when we talked about it, they were like, no, we want to know that number. And maybe they aren't on a day-to-day basis, thinking about that number, but when we're speaking the same language, they really spoke up and said that that's helpful for them to understand. So, so that's where we kind of pulled their feedback together. Josh put together a nice, quick Microsoft Office form that we kind of went through and had team members. After we'd had that meeting, we said, okay, thanks everybody for your input. Here's all the goals, and here's kind of fleshed out an idea of what we may do. Josh put this quick survey together, and we sent it out to the team. And we probably had maybe a 30% participation rate. Do you think, Josh?
Yeah, I think by the time we're done, I think I may have taken a screenshot a bit early, but
No, yeah. So like a 3, yeah. But so we didn't have 100% participation, but we had people participate and say what they wanted their goals. And I think that was 100% what we wanted to have happen, is for them to feel like we told them about their goals. They had that participation in it. And then when we talk about them, we say, hey, remember, this is the goal that you guys voted on and wanted to talk about. And so this week we're talking about it. So kind of use this scale of, this is a meaningful goal to me, versus I don't, this is something that's required, or I don't really know what the heck this means. It's not really meaningful to me. And that's how we kind of gauged the staff engagement with it up front before even setting those goals. So I think this is a super useful tool that Josh put together. Do you want me to keep going? Do you want to jump in, Josh?
I can take this one.
Okay.
And then and as part of sort of this goal cascade process, we did kind of like a self-check. You know, how are we doing with this process? And so we had taken this tool that was devised by my brain isn't working, but our THC team, Brad, thank you. You're on the call. So had also brought this into forms and got some really good feedback from our managers. It's why the response number is so low. We only have a few within transplants, but we did find that, you know, at the end of this process, all of them were well aware of the organizational goals, objectives, and so forth. Well aware of where their leader was. All of them meet at our tier 2 level with our senior director. And so they were kept apprised of that particular level of goal. And then most of them, and certainly all of the ones who had gone through this sort of tier 1 goal deployment process, did identify how they could articulate how their department will contribute to the organizational goals, to the tier 2 goals. And a couple other elements here. Just a couple of definitions for our purposes, the domains, you know, these are the categories that we're used to. The goals are kind of that high level statement of direction. So we would like to improve readmissions by this much. The objective is we would like to reduce them by 15% or some such. And that's the additional component of that key result piece is just making sure that we time frame was what time bound goals. And then, you know, how that arrives and sort of that objective key result pair, you know. We're monitoring our actual observable, measurable outcomes as we go compared to whatever target that we set based on our objective and key result pairs. And then, you know, as we're checking in with our leadership, identifying that these are, whether they're on track, whether we're close, whether we're falling pretty far behind, and we need to take a look for different supports or escalation needs. So forth. So, some key takeaways for this, goal deployment really is aiming to align the organization with focused priorities. So kind of have that at the hospital system level, and so how can we align our individual department goals with those sort of ethos behind what it means to have, you know, high reliable care, efficient services, improved access to our patients, and so forth. Allowing us to kind of take a standard uniform approach to all these things, you know, utilizing not just the brain power of a single manager for each team, or even, you know, a director level indicating for each tier 1 what their goals should be, but incorporating voices across the health system, so we can really identify what can be done effectively each level of the organization. Identifying a few focus areas so that we're, again, not spreading ourselves too thin. Transplant had been doing DES for quite a few years. We've been doing goal deployment quite a few years. Going back, I think as early as 2019 or earlier, even. But this was the first time that we had taken a crack at developing our goals earlier in the year. So, you know, folks at different ages and stages of DES deployment can certainly make use of this process, use parts of it, see what fits, that sort of thing. Questions? We did kind of zip through all that.
Thanks so much for sharing the journey. I really appreciate, especially, you know, Danny, that you're vulnerable. You're like, well, my team doesn't want to know this. And you told them that. And they were like, no, I did. And, and it's helpful for us to know. And it seems like something that wouldn't really be relevant. But when we share that and like, this is what I'm supposed to be looking at, it helps them get behind it and say, okay, well, if this is the outcome, then what are the things that I can do in my daily work to make a difference, throughout the year. I think that journey is really powerful. So many points of it, like how we thought we had to wait for all of the system goals to come out before we set our goals, but we all know the direction we're going and we know what our impact to the overall goals are. And so thanks, Josh, for really coaching and teaching that team, how to take control of goal deployment and really work on it. And just appreciate the camaraderie you all had around the goal deployment. So
Yeah,
I
and
know
I
it's a small team here. I just want to see if any participants have any questions. Oops, are you guys doing your own goal deployment, setting goals this year yet? Or any questions for the journey that transplant went on?
I think what you said, Carrie, is really important as we set these goals, but to make it meaningful to the frontline people, they need to know how their actions affect the goals. And so, the way that we track that data or the way that we display that data, may not be exactly what we think is going to be meaningful to people. And so one thing that I really liked about the DES huddle tracker is the way that it has kind of the goals broken down. Especially Josh, you're gonna have to remind me, I should have pulled it up of what it looks like, but where it talks about like committing of like, what are my day-to-day actions that I can do to move the needle on this goal? And so I think that our conversations as part of our talking about our alignment weekly as part of our huddle system that's where it's really made the data a lot more meaningful, because it used to be everybody would be like, oh, it's Wednesday, it's alignment, I don't want to do this part, I don't know how to read graphs, and so now we're starting with, okay, let's read through what our goals are and what those day-to-day actions are that you guys are taking that relate to the success of that goal. And then we pop over and we look at the actual graph. And now I think people are, having just that connection piece instead of being like, oh, here's our graph, this is the data. I think talking and saying like, remember, this is our goal. These are the things that you guys are doing that contribute to this success. And then this is how we're being financially stable as an organization. So I think connecting those two pieces has made a difference in our ongoing huddles throughout the year.
That's awesome. It sounds like it turned more into a conversation about what are we doing to contribute to our organization instead of a report out.
Exactly.
And for some reason at UCSD, everybody thinks, oh, we need to report out. We need to report the numbers. We need to report the numbers. Everywhere I go, they talk about, it's a report. Are we red? Are we green? And it's like, no, what are the behaviors? Like, what are we doing every day? And how are we all getting together to make that difference? So that's more impactful than reading a number.
Yeah, and I think, as leaders, right, like, we need these numbers, we need these metrics, and like we understand some of that. But when you want to talk to the frontline caregivers and the people who are doing the work on a day-to-day basis, like all of that just goes over their head. And, some people have been through, have done advanced degrees or have done projects and things and are familiar with data, but there's so many people who still feel a little data illiterate and are a little intimidated by that. And so to folks who aren't used to looking at graphs and numbers and data and living their life obsessed with it, it's those behaviors that really mean something to them. And that's the only way that I think you can get through to them. So I love that you're championing that balance, right? Between like, what's our data, but what are the day-to-day things that are moving and changing?
Super awesome. Well, thank you all so much for sharing. And thanks for coming prepared. I'm sorry it happened to hit on a day when we also got notice of a work stoppage. So everybody was pulled like literally at 11 o'clock to go to a different meeting. So
Unfortunately, that's our life these days.
yeah, does anybody have any other thoughts or brainstorming of things that you guys are doing on goal deployment?